I mean, like all these ACLs you see, I always tell patients it's really difficult, the physio. It's actually harder than the surgery. The surgery is the easy bit. And this is what patients have to get their head around, that you need really specialist physio to get around that. Would you agree with that?
Yeah, I mean, absolutely. The rehab, patients don't often understand that it's 9 months to a year after the surgery that you're really working hard to get back to the sport. I mean, earliest after an ACL, maybe 7 months if the rehab's gone really well, and other factors contribute to that. But the key thing I think that we've got here is being able to work direct together. If I've got an issue, I can come in with the patient, speak directly to you here, which makes it a lot easier.
I'm saying that's absolutely right. Most of the time, you sign the form and they go 9 floors up. Some 2 or 3 weeks later, they come back down to see you, and they have various complaints about, oh, the physio just put me on electrodes, or I was on a bike and the other guy was on a bike at the same time. I hear that all the time. Here it's a one-on-one service. Okay, we're not going to get quite the level of Antoine Dupont in terms of what he's going to have built around him. We're going to get something close to that, I think.
Yeah, absolutely. We've got a great gym set up, and all our physios here really have got a lot of experience working with ACLs and returning players to sport. And that's the key thing, is what does that patient want to get back to doing? What's their sport? What's their hobby? And we can gear that rehab towards that, especially in the later stages. But we follow protocols from each doctor. It's very sort of stringent. What we're doing for 2 weeks, what are we doing for 6 weeks after surgery, 3 months, 6 months?
Yeah, and that's exactly right. Because having that rapport and knowing exactly what the surgeon wants, what the physio wants, is really key to it. And in fact, actually, you guys probably make us look really good. You know, that's the thing at the end of the day. It's not us. It's actually you making us look good. No, I'd say that without any hesitation. It really is that. It is won and lost with you guys.
Yeah, and I think as long as the patient expectations are understood, the surgery goes well, which it does with you guys, and it's generally straightforward for us. There's up and downs along the route with every patient, but normally the end goal, we don't have any problems getting people back.
Yeah, and that's the art of it, isn't it? Everyone has a slightly variable. Some people are much more motivated, some not so much. And then again, that's where you feed back and say they're a little bit down on their time, or they're progressing really well. So, you know, you can jazz with the program as well with that, which is what, someone of your quality as an expertise can do that. Whereas if I was with someone I didn't really know, or I didn't think there was, I couldn't leave it with them. But with you guys, I know I can definitely leave it.
Yeah, 100%. And it's understanding the patient and what motivates them and what their goal is to get back to. The rest of it is you've got to make it individual to each person. Right? As we know from the patients we've worked with, some of them are very easy, stick them in the gym, give them the program, they'll do it. Other of them need to hold their hand a little bit more, guide them.
Or big kick sometimes, or turn up.
Yeah.
Is that sometimes the case?
100%.
Yeah, you have to turn up.